Michael Bloom here, chiropractor. Thanks for watching. The term torticollis may be familiar to you, may not be familiar to you. The term wry neck might be familiar to you if torticollis isn't. Most people have either heard of wry neck or torticollis, which essentially are much the same. And let's just delve a little bit into torticollis in an adult scenario, because there's actually two clear distinctions. There's torticollis from birth, from the birth process, and there's torticollis when we are an adult. And I'm just focusing on the torticollis as an adult for the sake of this discussion. So torticollis or wry neck, what it actually means is that your neck is in a lot of discomfort, usually on one side, usually in a way that your head doesn't feel like it's on or isn't actually on straight, looking straight ahead. Often it's a little deviated to the side, maybe even in an angle like that. And it's incredibly painful, torticollis. The causes of torticollis are unknown. There's nothing I can tell you that will guarantee that you won't have torticollis sometime in the future. In my experience in clinical practice, I've seen it far more often in females than in males, and usually in that age range of, say, 20 to 40 age range. But still, I've seen it in males. I've seen it outside of those age ranges as well, just more commonly in those age ranges with females. And it's idiopathic, which means we don't know what causes it, which is a damn nuisance in a real life scenario, because if we knew, well, we would do some stuff to stop it happening if you were a torticollis sufferer. Well, whilst I mentioned torticollis sufferer, it is relatively common that if you have one bout of it, you can have multiple bouts of it. It's almost like it's a little bit of a pattern within certain people, that they can have clear runs where they feel totally fine in their neck. Then they have a period where, ouch, it's just super clamped up, super just immobile and painful and uncomfortable. And we don't know what it's caused by, sadly. One of the theories is that it can be from your sleep position, because it's really common that the first time people will notice it will be when they wake up in the morning. And the sleep position, or a draft, funnily enough, coming into the room. So draft maybe from a split system air conditioner, or a draft under a door, or a draft through a window. There's theories that that might also be a precipitating factor with torticollis, but I don't know that any of these factors have actually been proven. So that's what torticollis is. It's usually self-limiting. Self-limiting means that it will go away. Whether you do something about it or not, it will go away. But there are some strategies that I want to talk to you about that you can employ to increase the likelihood of it going away just that little bit quicker. So let's go over some of those now. So one of the strategies that you can undertake in order to help torticollis disappear is actually the application of ice if it's in its acute, nasty, angry phase. Get ice packs onto that area of your neck just to cool it down, slow the metabolism in the area, give the body a chance to heal through that area through less bodily requirements from it being in colder temperature. So ice packs on for 10 minutes, off for 10 minutes, on for 10 minutes. Generally do this in the first 24 to 48 hours of having torticollis, because after that period of time, we tend to progress more in towards utilizing heat rather than ice. So ice for the first 24 to 48 hours. Going to see someone who's actually experienced in dealing with torticollis, and actually there's a skill on assessment and implementing some mechanical change to the structures, to the muscles, to the bones, to the surrounding structures, can really help fast track your body's ability to heal from torticollis. Personally, I've seen plenty of cases of torticollis, and usually they are resolved within a couple of weeks if the person totally resolved, but usually the pain decreases significantly in a hurry, and then it takes a while for it to fully leave you. But it accelerates if we're able to get some hands-on correction and just help with the mechanics of the structures that are aggravated in the first place. So the application of heat is really useful after the 48-hour mark has happened with torticollis. If you use heat, you put the heat pack on for 20 minutes, remove it for 20 minutes, and place it back on for 20 minutes. And then once you're starting to feel some movement coming back into your neck area after a couple of days or towards a week, some stretches where you're doing resistance stretches against your own hand can prove to be really useful in getting some of that range of movement back. So if you're really struggling with your torticollis to turn to your left, that your neck is only getting to there, then doing a stretch where you have your right hand against your cheek and you're pushing into the hand, but your hand is stopping your head from moving, and relax, and then just move it slightly further, and then you're pushing back into your hand. So you're pushing, if your hand wasn't there, you'd come back that way, but the hand's stopping your head from actually moving. You're pushing, relax, and then move a fraction further. Push, relax. That's called P&F stretching. That really helps to bring some of that range of movement back that you may have lost with the torticollis. So, take-home messages. Torticollis, very common, more common in females than males in my experience. Ages 20 to 40, it's not dangerous, it's self-limiting, it will go away. There are things you can do to manage the discomfort. There are things you can do to accelerate it leaving you. But ultimately, if you are suffering from torticollis, I feel for you because it's super debilitating. But at least rest assured that it's not an indication that you are going to have a crippled neck for the rest of your life. So stay upbeat, you'll get through it, get in the hands of a professional who knows what they're doing, and you'll get through it even quicker. Thanks for watching.